Hi, this is Dr. Cordy. So what happens if I just take birth control pills, my symptoms go away, and I don't do anything else about the rest of the things that I feel like I have with PCOS? You could take medicine for all of it, and you could suppress all the symptoms that you have, whether it's the hormone symptoms, the high androgens, so you have acne, so you have abnormal hair growth. You could suppress those symptoms with the birth control pills for sure, and that may work really well for you, and you might like that answer. But the problem is birth control pills also increase insulin resistance. And so if we don't manage or handle the insulin resistance, which is far and away the most common kind of PCOS, what we'll end up with is a system that now has insulin resistance, which we know increases chances of endometrial problems like cancers, liver diseases, cardiovascular diseases, and, and other systemic inflammatory conditions long term. It increases the risk of all of those things when we don't handle those. And so we want to be able to handle the PCOS symptoms as quickly as possible, but way more importantly than that, we want to be able to handle the underlying condition that's really stimulating the abnormal hair growth, that's stimulating the acne, that's stimulating the mood imbalances, that's stimulating the infertility, so that in the future you have predictable cycles, you have predictable skin health, you have predictable hair growth or not hair growth, and you have predictable inflammatory patterns that you understand how to control from a really holistic place of taking care of yourself, whether it's stress management, dietary management, sleep management, and sleep hygiene is huge, and then watching those symptoms improve over time. So figuring out where your PCOS is coming from and really handling the root cause of that is more important than handling its symptom. However, it definitely takes more work than just taking a birth control pill. So you have to be ready to really look at what you're doing on a day-to-day basis. And the tool that we use in our practice for a very long time with all of our patients is journaling. And that doesn't mean long books of journaling on a daily basis. It just means food journaling and symptom journaling. And we really look at that and how those two things coordinate, how food and sleep behavior and sleep quality and bowel movements and just regular digestive processes correlate and coordinate with the symptoms you're having that show up as PCOS, whether that's anxiety or depression, or again, the sleep problems, whether it's hormone imbalances or PMS, sugar cravings, all of those things. We really look at how all those coordinate, and then we help you understand how to bring those two worlds together so that your actions and behaviors start to better control the symptoms that you have and over time improve them, which is why we not only look at food journals and symptom journals, we also look at what we're doing to change those things and mark and record and watch that happen over time. So as you improve your health, you know why you did it, because it's definitely your fault. It's definitely your fault when you improve your health. It takes a lot of work and a lot of effort. And I want to make sure that we can understand the good things that you do and how they relate to the symptoms improving over time. So that's probably the most important thing we do in our practice to watch improvement happen, is really diligent journaling. And I will find that my patients who are very honest and journal the best or the most diligently are the ones who really have the best results and are most dedicated to their care and really take the biggest responsibility for their care in terms of actually getting better over time. And then they really know how to do that for the rest of their lives. And that's my goal, is not for you to feel better for the next 1 month or 2 months or 6 months. It's for you to really understand how to manage your entire life for the rest of your life and take really good care of yourself, so that you understand how you can affect your symptoms and how you can affect your underlying health in a really powerful way. So I hope this helps. And